Welcome to Knights of the Blind, the show that pays tribute to the promise that Lions made to Helen Keller back in 1925 to, well, be Knights of the Blind and advocate for those with vision and hearing issues. Our show tonight has a guest that epitomizes being a Knight of the Blind. I'd like to welcome and introduce you to Dr. Steve Tronnes. You came up from Roseburg today.
Yes.
We appreciate that. Tell us a little bit about what you do in Roseburg and how you help people in terms of being a Knight of the Blind.
I'm an optometrist at Weston Eye Center. I've been there for approximately 13 years. Came from Eastern Oregon, John Day, where I was also a Lion for 7 or 8 years out there. Enjoyed that time. At Roseburg, we have 2 other doctors besides me that are full-time, and then 6 other doctors that rotate through our clinic doing different specialties that they enjoy as well.
You are a Lions Club member.
Yes.
As well as being a doctor. So it's just tremendous that you're helping people in Douglas County with vision issues, but then you're helping people throughout Oregon and maybe even beyond through your work as a Lion. First of all, tell us a little bit about the Roseburg Lions, how the Lions Club in that community helps people.
The Roseburg Lions Club has approximately 60 members, and fortunately most of them are active, so that really helps us with our different projects that we do. Obviously we have to raise money, so we do the traditional things like selling See's candy, selling chicken strips at the fair, doing other various fundraisers. Those go to projects that we do. Some are donated to schools in the form of scholarships or other things. We do flags for first graders, where we donate a flag to all the first graders in Roseburg. There's 2 other clubs in Roseburg that help us with that. Each student then learns about the flag, says the Pledge of Allegiance, learns why we pledge allegiance to our flag.
So if somebody's sitting at home right now is watching this, Lions do more than actually being Knights of the Blind. They help kids understand patriotism and our country, and I know that Lions clubs throughout Oregon do all kinds of other community service projects, which is just fantastic. But I think the common denominator is that all Lions clubs really have as their base mission that sight and hearing component.
Yeah.
That's fantastic. So if I understand correctly, as a Roseburg Lion, you have actually been elected to be a trustee with the Oregon Lions Sight and Hearing Foundation. So and within that, you have a unique role that you play as chairman of the Patient Care Committee.
Correct.
Could you tell us a little bit about that?
Sure. I'll start back where you started as far as being elected to be on as a trustee. The Lions have several districts. We're District E, and so it wasn't just the Roseburg Club that was a district thing. There are several representatives. We serve for 3 or 4 years and maybe a second term, and then we're termed off. The Patient Care Committee, which I really enjoy because obviously being an eye doctor is near and dear to me. We focus on sight and hearing. We provide surgeries and other sight and hearing restoration procedures for the people that apply to the committee.
So this committee, again, epitomizes this concept of Knights of the Blind. People in need throughout Oregon that maybe lack health insurance and lack the ability to pay for critical surgery or treatment, essentially apply for help.
Yes, they apply. Most of the time, what we like them to do is apply to their local clubs. So a person lives in Roseburg, for instance, they will apply to one of the clubs there, and the application goes to the sight and hearing chairperson or committee. They evaluate the application, evaluate the person. They usually do a home visit to determine that everything is there. They have to meet certain income requirements. Then the application is forwarded to the foundation. The foundation collects the medical history if it hasn't been already. Then the committee reviews what's there and determines whether they qualify for the care or not.
And right before we went on air, you shared with me that you just arrived here from a committee meeting of the Patient Care Committee. So tell us just a little bit about what happened today. What did your committee do today?
We reviewed, I don't know the exact number, but probably 20 applications. Total dollar value would be in the neighborhood of $30,000 to $35,000 of care that was requested. We have a budget of between 10 and 15,000 for that. So obviously
for today's meeting.
For today's meeting.
Okay.
So obviously we can't meet all of those. Fortunately, we have doctors in Oregon that either reduce or charge us nothing. So we're able to refer the patients to those areas and get the care, and because of that, multiply those dollars. So that $10,000 gives $30,000 in care.
Wow, that's a powerful opportunity that you give to prospective supporters of your program.
Correct.
So you could go out to an individual or a corporation or a foundation and say, if you give $1 to this program, it in essence is multiplied in value in terms of the health care that's actually provided.
11-year-old girl who has a hearing problem and is not able to hear because of the foundation, because of the money that we have, we're able to provide her with a surgery that would probably cost around $5,000. We were able to provide the surgery for around $1,500, and now she's going to be able to hear. She was not doing well in school because she couldn't hear anything. This should turn that around.
It's a heartwarming story, and it's also an example of how when Helen Keller, back in 1925, with the help of her mentor, Annie Sullivan, appeared before Lions and asked the Lions to take up her cause, it wasn't just blindness, but it was hearing loss also. And Helen Keller's got this great quote, this statement that she made where she and I'll apologize in advance for not articulating this exactly, but she said something in essence that blindness separates the blind from things, but hearing loss separates people from people.
Yes.
And so this little girl that asked for help, you're going to help reconnect her to people.
Yes.
Which is just wonderful.
Yeah.
And it sounds like her need was far more than just needing a hearing aid, which is a critical thing to be able to provide. Can you tell us a little? I realize that you're a vision professional,
yes.
so this might be outside your expertise a little bit, but tell us a little bit more about her unique hearing issue that she has.
The report from the school was that she was not able to respond, obviously, to the teacher, and classrooms aren't designed for every handicap or every disability, whatever term you use. And so she was not learning. And that, just automatically puts her behind. This way.
Is she in a traditional classroom?
Yes.
Wow.
Yeah.
Wow, good for her.
Yes. So
I'm sorry, continue.
Yeah, well, so now she's going to be able to continue in that classroom and hopefully be able to excel. Of course, we're projecting that she
Sure.
will, because her family has been so forceful in getting her the help. I think they're going to be just as forceful in helping her to excel in school. And
this is a young person on the other side of the mountains in eastern Oregon. So your program truly helps people throughout Oregon, young and old,
yes,
vision and hearing.
Yes.
Yeah, it's really wonderful to hear that. So thank you for helping this young person. Although most of the applicants, I understand, are sight related.
Yes.
Maybe an example of how you help people see.
One of to me, the most rewarding situations is a young diabetic retinopathy patient who isn't able to see. We have one in particular that came to us quite a few years ago when she was around 20, was blind and was not able to basically do anything because she couldn't see. She was unemployed, not maintaining herself. She had no health care coverage, so her care was the emergency room. Wow. And so they would put her back together. We were able to, with the encouragement of the sight and hearing people, encourage her to take care of her health as well as provide her with retinal surgeries. She's now able to see, she's now employed, she's living on her own. To me, she's one of our biggest success stories.
That's great. That's great. So if you would, being that vision health is within your scope of expertise, can you just kind of rattle off for us some of the examples of treatment and surgery from a vision standpoint that patient care provides?
The laser procedure, pan-retinal photocoagulation is the technical term.
Is there going to be a quiz at the end of this?
Yes. Laser procedure for diabetic retinopathy.
Okay.
Retinal detachments, corneal transplants, and those have really progressed lately. There used to be what we call a full thickness transplant. Well, now they can do layers instead of the full thickness and tremendously improve people's vision without the destruction that full thickness causes. Cataract surgery is probably the most common surgery. That helps, obviously, typically the older population, and so those probably the largest single surgery that we do.
I'm also fascinated to learn more about the scope of the patient care program in terms of, who are these healthcare providers that are joining forces essentially with the Lion Sight and Hearing Foundation. You mentioned a young person in La Grande. Can you kind of give us an idea of at least the communities where some of this healthcare takes place?
Pretty much every community in Oregon. We have Medford and Ashland. A lot of these folks are from outlying areas, Merrill, Klamath Falls, many different areas.
I know that you mentioned Klamath Falls and Merrill, so okay, in Southern Oregon, I understand in Ashland, there's a facility, the Retina and Vitrea Center,
right.
I think provides quite a few of the surgery and treatment.
Yes.
I think sometimes there's a misperception that in Oregon, everything happens in Portland.
Yeah.
And that's not necessarily the case, is it?
That center is in District E, which is, of course, in my district, and I'm very happy, very proud that they're there. They provide patient care and surgeries and retroactively then apply for help for the patient. They're pretty much the facilitator for the patient to access that, but they've already provided the surgery. So when we're reviewing their cases, we're not under a gun to say, yes, we have to cover it or they're going to be blind. These folks have already done the surgery for us, and they accept a reduced fee. They've been tremendous for us in their help.
So this team of healthcare providers, you're again an optometrist. It sounds like we have other vision professionals which would include.
Do you want names?
Sure.
Yeah.
Oh no, not the title, ophthalmologist.
Oh, ophthalmology, optometry. Opticianry does too in the glasses. That's typically from the local club area, but sometimes the clubs don't have the funds, and so they will apply to the foundation for funds for eye exams. The local optometrists have been tremendous in helping the clubs with either no fee or reduced fee for their care. Yeah,
the generosity and the dedication of the healthcare providers within this patient care program is nothing short of phenomenal. There's a healthcare provider that I know that you're very close with that helped pioneer a concept of mission trips.
Correct.
Here in Oregon. Could you talk to us a little bit about that?
Sure. I joined Dr. Weston, as I said, about 13 years ago. He had been on a trip to China delivering cataract surgery there. Came home and said, we have a lot of folks here that can't afford it in the U.S. and in Oregon. Let's see if we can do something here. And so he put together a program in Oregon to provide that. He was doing that for several years and said, whenever the Lions take over a project, you just get out of their way because they make it a big program. And so the Lions Mission Cataract now started with him, and then there were a couple other doctors that joined in, and now we have, I think, over 30, maybe more than that at this point, ophthalmologists from around the state that provide this procedure, cataract surgery, at no charge to the patient. Yeah. And to the foundation.
Yeah, I love the concept of mission work.
Yeah.
And you hear quite a bit about doctors that might take a trip to Mexico or India or even Africa and do mission work. But I really love the concept of doing mission work here in their own backyard. And that's what you've just described in terms of the Lions Mission Cataract Program. And you're right, there are now just over 30 ophthalmologists that are helping, give the gift of sight here in Oregon. Many people are eligible to get help that don't realize it. And so I'm stopping to let you know that if you know of somebody that might fit this category of having a cataract and not having the need to address it, we are going to put an email address up on the screen and a phone number that you can call and contact and ask how to apply for this patient care program, for our Mission Cataract program, and how to get assistance to those that most need it. It's why Lions do what you do. I love your motto of "We serve," and I think it's been since like 1918 or so. Lions have been around, and it was in 1925 again that they took on the challenge that Helen Keller provided to be Knights of the Blind, and Dr. Tronnes, you definitely are one of these Knights of the Blind. So the Oregon Lion Sight and Hearing Foundation, as a trustee, what are some other ways that the foundation exists to help people? I know that there's some vision screening.
Right, the mobile health screening program is a tremendous program. That's another one that the Lions got going, and you just get out of the way because they make a big program. Originally, there were 2 big 18-wheel truck trailer combinations that would travel around the state and provide screenings. And because they were so large, they could just go to one community at a time, screen maybe 100 people a day. Good program, but not as efficient as it could be and more expensive than it needed to be. So a few years ago, the foundation developed a program of 12, at this point, screening kits, we call them, where those kits are stationed around the state. And screening now can, for students, they can do up to 500 at a time, 500 in a day, maybe even more than that once we need to, but most schools aren't any bigger than that. Our original goal was 25,000 screenings in a year. We moved that to 35,000, went past that to 50,000, and I think we're past that. And the next goal is 75, and I'm sure we're going to pass that here shortly too.
I know that we've had some guests on the show in the past that have shown the photo screeners, and we've described what a school-based vision and hearing screening event looks like now. Of course, when we were kids, in fact, it's still happening in some schools, where there's that chart on the wall. Some programs use a light box, which is better than the chart on the wall. But this is a whole new method of objectively screening. So if you would, please describe a little bit about the advantage of having an objective screening method for identifying kids that should be going to the eye doctor.
The spot automated refractor is, I think, the device you're referring to, and it allows us to get an approximate prescription for the patient in seconds, for the student in seconds. They don't need to be responsive. We've done special ed students. We've done non-English speaking students, 2 to 3 years old. It's really a super quick program. The student doesn't need to do any input. They just look at the device and we have the answer.
So I've volunteered, and I've been at one of these screening events before, and my first experience as an adult was, they spent about 10 minutes training me, and here I've got kids that are first graders, the cutest little kids, but they're bashful, and I'm asking them to tell me if this is an apple or a house, and they're giggling, and they're not being real verbal.
And they can't hear you.
Yeah,
and you can't hear them.
And I think sometimes they're guessing, and their buddies telling them what it is.
Yes.
And I'm thinking to myself, I'm not qualified to tell whether or not this little girl is really seeing this, at a 20/20 or a 20/30 level. And I'm so pleased to see the new technology.
Yes.
And the fact that you can get these great volunteers that mean well, but now don't have the pressure on them to subjectively estimate at what level the child is seeing. I guess what I should say is that now families can confidently be told that your child vision is 20/20, or more importantly, your child really needs to go get a full-on dilated eye exam.
The test that you were talking about, the wall chart test, typically doesn't pick up farsightedness, called hyperopia. A lot of times it misses amblyopia because the students maybe don't cover their eye or something. In the kit, besides this spot, are stereo tests. And in order to pass that test, they have to be able to utilize both eyes together. And if they don't, they won't pass the test. So then we find out that there's a problem there.
Yeah, so, I know that there's a variety of reasons why vision screening is important. And it's very important to do it at a very young age. But let's face it, not all kids get their vision screened when they're really young, or even then the eyes are growing and developing just like the rest of their bodies, and so the child might have a screening at a certain age that appears to be okay, but maybe later on they still need to be screened perhaps. When children are being screened, it isn't just whether or not they need eyeglasses, which is huge because a lot of kids don't read well,
right,
only because they don't see well. But you mentioned the term amblyopia.
Right.
And I understand that about 4, maybe 5% of all children might have amblyopia. Can you tell us, though, not everybody, I'm guessing, knows what that is. Yes. Tell us a little bit about amblyopia.
It's when the person, typically a younger person, but you can grow up with it too, obviously, is not able to see with one eye, typically better than 20/40 with the best correction. We can't correct them better than that. And there's not a health problem. There's not like a cataract. There's not a something else going on. Typically, it's because there's a difference in prescription between the two eyes, but there can be other reasons as well. And when they don't see with both eyes equally well, there's a lot of things that don't develop properly. Balance, sometimes reading skills, baseball, ball sport type skills don't develop right.
Kind of hard to catch a pop fly if one eye is seeing better than the other. You have a depth perception
problem.
So the term amblyopia in layman's terms is often referred to as?
Well, they call it lazy eye. I don't like that term because I never am for sure what they're talking about, because once in a while they also mean an eye turn. Strabismus or an esotropia, exotropia, an eye turn sometimes is called lazy eye as well. And so that is a term that's utilized for amblyopia.
So when I was a little kid, one of my older brothers, I have this memory of him having a patch on his eye for a while.
Yes.
And I was a little kid. I never knew why.
Yeah.
Most likely, why was he wearing that patch?
Because he had amblyopia. So what's typically done is patching of the eye that sees well in order to stimulate the non-seeing eye or the non-well-seeing eye.
And isn't that, okay, now again, you're a doctor, so to you it's like you see this all the time, but for those of us that are not, it's counterintuitive that the bandage goes on the good eye. You always think, well, the bandage.
Something's hurt, covered up.
Right, so when we see a child with a bandaged eye, very likely that's the good eye that is being patched, not necessarily bandaged.
Right, and it's an older technology. There are newer technologies than patching, because kids and parents don't like the kids wearing the patch, and there's not a lot of cooperation. So there are newer technologies to stimulate the more poorly seeing eye.
So in essence, the purpose of that is to get the brain to more actively work the optic nerve of the eye that isn't completely healthy. Is that about right?
Yeah.
Okay. I mean, that's the way I can understand it. So okay. Well, it's great to know that that more kids that have amblyopia are now more likely to be detected with it.
Yeah.
And again, it's an example of how Lions are being knights of the blind.
Yeah.
Because if we can detect the issue early enough, then the eye doctor can provide the right solution to it, and then those children can have that eye catch up and be healthy and be more likely to catch that
That's
pop-up.
right, yes.
That's great, okay. So yeah, Lions do so many things beyond just surgery and treatment, but getting into the schools now and helping children that need to find out that they should go to the eye doctor to do that. So I'd like to, if it's okay, get back again to the mission trip concept, because if I understand it correctly, you've done some mission work beyond the Oregon borders. And could you describe a little bit about your mission experience?
Probably everybody's seen the, used to be yellow boxes, I think they're gray now, where we collect eyeglasses. Donate your glasses here for the Lions Club. Those glasses are collected and verified and cataloged. And then different people go on trips to typically other countries to distribute those glasses. Some folks have gone to Peru, Latvia, and I've gone to Mexico a couple times, southern Mexico, to do that. We take typically 8,000 pairs of glasses with us. In about 5 to 7 days of care, we dispense 2,000 to 3,000 pairs of glasses. And it really is wonderful seeing young people and middle-aged and old people be able to see when they haven't ever seen before.
So you're taking glasses that are donated, in our case, all around the state of Oregon, whether it's in Roseburg or in Salem or Eugene or Portland or in John Day or Burns, Lincoln City. There's these Lions
Everywhere.
collection boxes everywhere.
Yes.
And we will put a phone number again and an email address up on the screen so that if you have some eyeglasses that you don't wear anymore and you'd like to donate them, just think about that. The glasses you're wearing right now that you're gonna throw away could actually give the gift of sight to somebody in a village in Peru or really anywhere around the world.
Right.
It's really kind of fun to know that my old glasses can give the gift of sight to somebody in another country.
Yes. Yeah.
Yeah. So thanks for doing that work. And not everybody has the ability to get away or even the resources to do mission work in another country. But in hearing you talk about the patient care program and the other ways the Lions help, the thought occurs to me that there's an opportunity to do mission work right here in Oregon through a local Lions Club.
It's easy to join. The dues are typically minimal per year. I don't think any of them are over $100 a year. You typically meet 1 to 4 times a month, and you get together and decide what to do with the money that you've raised and help people out.
There's a real social aspect to Lionism, and attending a meeting, it's really easy to see that these are people that get along, they enjoy each other's company. Whether it's flipping burgers or maybe flipping pancakes, a lot of their events are designed to do good in the community, to have fun, and then with an end result again of giving the gift of sight, giving the gift of hearing. I love your example of the flags for first graders. It sounds like a lot of fun. So again, you're a Roseburg Lion, yet you have a statewide influence. Sounds like Lions clubs. Again, there'll be a number up on the screen that if you're interested in finding out where a Lions club is in your community, call this number or email us at this address, and we'll be happy to put you in touch with your local Lions club that can give you the opportunity to maybe help somebody in your neighborhood or somebody in your community, or like Dr. Tronnes, somebody abroad in another country. So Steve, thanks so much for the work that you do. Thank you for being a Roseburg Lion, a Oregon Lion Sight and Hearing Foundation trustee. Thank you for being a guest on Nights of the Blind.
You bet.
And we'll see you next time on Nights of the Blind, and thanks for joining us tonight.